So we are going to talk about the ultrasound application. Okay. So in ultrasound we have a ultrasound unit. In that there are two setups. One for frequency, the other one for the intensity. Okay. So and for the pulsed mode you can use the pulsed mode varying from 1:1, 1:2, 1:4, 1:8, 1:16. Okay. So these type of application you can use for the pulsed mode. Okay. So this is the transducer head. So this transducer head is having a crystal inside it. So that will be producing the ultrasound. Now we are going to see what are the techniques that we can apply with the help of ultrasound. The one is a concentric circles. Okay. So the transducer head has to be placed on the tissue. Then the transducer head has to slowly move in a concentric circular manner. Okay. The next one is the figure of 8 way. Okay. Same circular motion has to be applied, but the transducer should not be taken out of the tissue. Okay. So this should be in a smooth way. You can put a 8-like figure in a tissue. Okay. So we can apply coupling media on our skin and then we can start our techniques. Okay. So the one is circular, the other one is the figure of 8. The next one is the transverse strokes. The transverse strokes can be applied in the back region, which is the biggest region, so that you cannot complete the treatment with singular circles. Okay, so we can apply in a transverse directions. Okay, so then the next one is the longitudinal. This kind of strokes, okay, parallel strokes, longitudinal strokes can be applied. Okay, so the transducer head has to be in contact during the session. Okay, so can you please try the concentric circle technique? Yes. So, but in a slow way, but in a smooth way. Okay, yes, that's it. Okay. Yes. So, can you please try the figure of 8 pattern? Yes, yes. Slowly, the figure of 8 pattern can be done. Okay. So, these things can be done with the both continuous mode as well as pulse mode. Okay. So in pulsed mode, what is mark-space ratio? Off and on time. Mark for on. Space for off time. Yes. So the machine, the ultrasound apparatus itself will on and off the ultrasound beam output when you set the ratio. Okay. So when you set a 1:1 ratio, 1 millisecond will be the ultrasound output, the other 1 millisecond will be the ultrasound output off time, that is cut off time. Okay. So this pulsed mode can be used for a particular type of patients, like when you cannot use the radiation therapy continuously, when the person is not eligible to acquire this kind of ultrasonic therapy and all, we cannot do that. Okay. So for example, now I am going to tell you about the medial epicondylitis. Okay. So medial epicondylitis is this body projection. Okay. This can be commonly inflamed in sports persons and homemakers and all. So for that you have to apply a coupling media and you can do a concentric circles continuously over the medial epicondylitis for about 10 to 15 minutes. Okay. So this ultrasound wave is directly transferred inside the tissue. So what are the physiological effects we can expect? Heating effect and non-heating effect. Okay. So heating effect we can expect cavitations. Okay. And the tissues will be the tissues inside the treatment area will be having a cavitation. Cavitation is the upward and downward movement of the tissues which causes vibration inside the tissue. Those vibrations will give you a heating effect. Okay. So the therapeutic effects we can expect is primarily the pain relief. So the ultrasound head will be having a ultrasound beam coming out of it. So that beam will be having a healing effect in the medial epicondylitis. The inflammatory process will be healed with the help of the ultrasound therapy. Okay. So in the apparatus you have seen about the production theory. So for that, first you should not switch on the machine. Okay, you have to place the patient, you have to make the patient comfortable, you have to explain about what you are going to do, then you have to set the parameters like what and all you are going to do, then only you can switch on the machine. What is the reason? The crystal will get damaged when it comes in contact with the air. Okay, so inside this there is a crystal, quartz crystal. Good, quartz crystal will be placed inside. That quartz crystal will have a what property? Evaporation property. Okay, so if you place the transducer switched on in contact with the air, the crystal inside the transducer will get damaged soon. So that after switching on the machine and after all the intensity is set, then you have to put a coupling media over the tissue, then you can place the transducer here and all set for the treatment, then only you can switch on the machine. Then you can start your treatment. After completion of treatment, what you have to do? First you have to lower the intensity to 0, then lower the frequency to 0, then you have to switch off the machine, then only you can take out the transducer. This is for the crystal maintenance. Okay, so if you are not doing so, your crystal will be damaged and adequate amount of ultrasound will not be getting to the tissues, then the treatment will not be useful for the patients. Okay, so what are the variety of conditions we can treat with the help of ultrasound? Mainly inflammations. Okay, the inflammation of the epicondyles, okay, the inflammation of the shoulders, ankle, okay, all these things you can treat. Only the inflammation and also some of the adhesion type of the things you can use. Okay, yes. So what are the contraindications for the ultrasound therapy? Yes, if the tissue is having an open wound, then you cannot place directly the transducer. That is also a high frequency current cannot be given in the open. Then what else? Carcinoma. Why so? Carcinoma can be spread. Okay. The next is infection. Yes, the infection also will be spreading to the other tissue. Skin allergy. Yes. So the allergic reaction will be aggravated if you place the ultrasound head with the treatment duration. Within the 5 or 10 minutes, the allergic reactions will aggravate. Then after the treatment session, the allergy will be more. Okay. Then what are all the other contraindications we can expect? Yes, open wounds, cut injuries. Okay. So those kind of cut injuries and all will be having an active bleeding state. If the bleeding is also arrested in that time, if you give an ultrasound on the cut injury, then the bleeding can recur. Okay. So in this session you all learn about the techniques and the mitigation, contraindication, and how you have to use and what are the cares which is given for the crystal and how you can use the apparatus, all those things. Okay. Yes, you should recall this again and again when you are using an ultrasound. Yes.